Hi, this is Dave Villard, Pacific Coast Benefits, and today I'm going to do a brief overview of the Anthem Blue Cross PPO 1000 plan, one of the choices that you have at your company. I'm going to be talking about covered expenses, how the plan works inside and outside of the network, and just do an overview of some of the things that are most commonly used on a health plan. First of all, this is a PPO plan. And what that means is you have the ability to either use in-network providers or non-network providers. What I'm going to show you in this overview is that it's going to make a whole lot more sense whenever possible to use PPO providers, because it will provide you with co-pays for office visits, co-pays for prescription drugs, 100% coverage for specific preventative services, and most importantly, lower out-of-pocket expenses if you end up having a large claim, for example, a hospitalization. The first thing we're going to talk about is the overall deductible. The deductible is what you're going to pay up front before the insurance begins to pay on a large claim situation, either things such as hospital stays, outpatient surgeries, imaging, MRIs, CT scans, things of that nature. On this particular plan, if you stay in network, your deductible is $1,000 if you're single, and it's a $3,000 deductible for families. If you go out of network, it doubles. It's a $2,000 deductible for a single person and $6,000 for family. So obviously you can see staying in network is much better in this scenario. After your deductible is met on a large claim scenario, most of these plans pay a percentage of the claim after the deductible, and you share in that. This is called the coinsurance. We'll talk about that as we get down here, ways you'll see it listed here, for example, 40% coinsurance. What that means is you're going to be paying a percentage of the claim. The insurance company's going to pay a percentage of the claim, but at some point you're going to stop paying because you're going to hit your out-of-pocket limit. In other words, there's a $1 million claim. When do I stop paying? And in the scenario that we have here in network, you'd pay your $1,000 deductible, and then you pay a specific percentage of the claim up to a maximum out-of-pocket of $5,000, including your deductible. So in my example of a $1 million claim, if you were a single person covered on this plan, your max out-of-pocket for the year would be $5,000. For a family, it's $10,000. But again, if you look over here, if we go out of network, it's a $2,000 deductible, $10,000 max out-of-pocket, $6,000 deductible, $20,000 out of pocket if you use non-network providers. So again, I'm going to probably say this several times during this presentation, but you're going to want to stay in network as much as you possibly can. The next thing we're going to talk about is things that are covered where you don't have to meet your deductible. And the first thing we're going to talk about is routine care or primary care visits for injury or illness. This is when you go into a doctor's office because you're not feeling well, you injured yourself, it's not severe enough to go to the hospital in the emergency room. For those things, when you go see the doctor, you're going to pay a $30 copayment upon arrival at the office, and no deductible will be met. You're just going to pay your copay. If you go out of network, you're going to pay your deductible first. Once your deductible is met, the plan will kick in and cover 60%. You're going to pay 40% coinsurance. So obviously in that scenario, you're much better off being in network. The same thing applies to specialty care visits. These are doctors such as cardiologists, allergists, things of that nature. $30 copay in network, 40% coinsurance out of network after your deductible. Prenatal, postnatal care, same thing. You got a copay for in-network providers and a coinsurance outside. Other practitioners listed, retail health clinics, things of that nature, $30 copay again, and 40% coinsurance out of network. So again, staying in network is going to provide you with a much broader coverage and a much lower out-of-pocket expense. Chiropractic and acupuncture, the same thing. You're going to see copays in network and coinsurance out of network. And now when we get to the other services in office. So you go to a doctor's office and you pay a $30 copay for the office visit, and then during the course of an office visit, the doctor decides to do some procedures or prescribe or administer some type of a treatment in office. In that situation, you're going to pay 20% of the claim after your deductible in network and 40% out of network. So again, you're going to pay a higher cost percentage of the claim if you stay out of network versus in network. Lab and x-ray services, again, freestanding lab or outpatient, 80% coverage in network, 60% out of network. So you pay 20 in network. The cost outside of network is 40%. So you can see you're going to pay a much higher cost. X-ray, same thing we just talked about. So you're going to see as we slide down this list of coverages that pattern kind of continues throughout. You're going to pay a much higher cost of a claim if you stay outside of the network versus in network. So again, staying in network is very important. If in fact you have an urgent or emergency care situation, ambulance, ground or air, end up in an emergency room by ambulance, or if you're brought to an emergency room by someone else, you're going to see that the coverage inside of the network and outside the network are the same. And the reason that they do this is you really don't have a choice. There's not a plan for you to go to the hospital. It's just something that happens in an emergency setting. So you're going to find that they're going to cover the out-of-network the same as they would cover in-network. Where that doesn't apply is urgent care. So urgent care is not so severe. Maybe you can, you're going to see a provider after hours, you have a stomach ache, something of that nature. They really want you to use a network urgent care provider, and they'll cover that for a copay. If you go outside the network, again, you're going to pay 40% of the cost after your deductible. We'll slide down this rather quickly, but I want you to see the pattern here that, of course, staying in network is going to be better than out of network. I'm going to slide down to a section that I think is really important. You can read a lot of this yourself. This is inside of your Employee Navigator portal. But when we get down to preventative prescription drugs, you're going to see that there's specific immunizations that are covered at no cost in network. Those are part of the Affordable Care Act. And if you stay in network, you can have these type of immunizations, contraceptives covered at no cost. If you go out of network, you're going to pay, of course, 50% in this case of the retail cost. When you look at regular prescription drugs, we really break them into 4 tiers. Tier 1, 2, 3, and 4. Tier 1 is typically generic drugs. 85% of all prescription drugs have a generic equivalent. And if you do get a generic drug for a specific injury or illness, you're going to pay a $15 copay. Tier 2 is typically preferred brand name, meaning it's on their formulary list. It's going to be a $30 copay. A non-preferred prescription, those are ones that are typically not on the formulary list. You're going to pay a $50 copay for those. And if you do prescribed a Tier 4 drug, which are things that are normally either compound prescriptions, self-administered, self-injectable drugs, you're going to see that there is a higher cost to be paid for those, again, in network. When you go out of network, you're going to see if you use a non-network pharmacy, you're going to pay half of the claim. So again, you're going to want to stay in network as much as possible. The plan is available to you at open enrollment. There are a couple other plans that we'll discuss as well in other videos. If you have any questions regarding this health plan, please reach out to us at Pacific Coast Benefits. Thank you very much.